barber-surgeons. And
Barber
you know that,
surgeons.
yes, barber-surgeons, actually barbers are our predecessors. They are the first surgeons.
Okay, hold on. Barbers were the first surgeons.
Yes, so these
Okay,
barber
that's
surgeons over a period of time evolved into an association of barber surgeons.
You are watching Surgery Simplified. शस्त्र कला सरल शब्दों में.
हेलो फ्रेंड्स, वेलकम टू आवर चैनल सर्जरी सिंप्लीफाइड, शस्त्र कला सरल शब्दों में. मैं हूं ऐश्वर्या एंड अगेन आई हैव विद मी डॉक्टर निखिल बलजेकर.
Hello, namaste to all the viewers.
सो आपने पिछले एपिसोड में देखा होगा कि हमने डॉक्टर निखिल और उनकी जर्नी के बारे में बात की थी कि हाउ ही स्टार्टेड हिज द प्रैक्टिस ऑफ डूइंग सर्जरी एंड वेयर डिड ही स्टडी एंड ऑल दैट स्टफ. आज के एपिसोड में डॉक्टर काफ़ी इंटरेस्टिंग होने वाला है, आई एम श्योर.
Yes.
एंड व्यूअर्स, लेट मी टेल यू दैट आज हम बात करने वाले हैं द हिस्ट्री अबाउट सर्जरी. सो डॉक्टर निखिल, मुझे तो पता नहीं, आपको ऑफ कोर्स पता होगा, बट प्लीज़ डू टेल अस कि व्हेन डिड द सर्जरी स्टार्ट एंड इज देयर एनी रिकॉर्डेड हिस्ट्री, आई मीन, ऑफ सर्जरी इन द हिस्ट्री ऑफ मैनकाइंड?
Yes, actually, though surgery is considered as one of the most modern sciences within the medical field, because if you trace medicine as a profession, it has existed for as long as prehistoric times.
Prehistoric time.
Yes.
Okay.
And there has been some archaeological excavation in France which showed some skulls with holes made them, which had been made with an instrument.
Okay.
So probably that which is around 6500 BC is the first recorded history of surgery or of a surgical procedure having been done. But there is a long gap after that. We come, around 2000 BC to Mesopotamia, which is today's Iraq, where there is recorded surgery activity. And this activity was predominantly three types. It was letting of blood, second was drainage of abscesses, and third was amputations. Probably these used to be related to wars, wounds which are related to wars. And after that we come to written recorded history, which is the Egypt. There's a name for it. It's something called Eresus Papyrus or something like that, which is recorded history of surgery being done in Egypt, which is around 1550 BC.
1550 BC.
Yes.
Okay.
After that, there's not much recorded history, and then we come, to the era of the modern surgery.
So, Dr. Nikhil, you spoke about prehistory surgery done in Europe or other part of the world, but what about something that might have been done in India?
Yes, in India, the first recorded surgery is by what is called as Sushruta Samhita, which is a collection of surgeries written by the surgeon Sushruta, who was a sage who also did surgery, and he is accorded as the father of Indian surgery.
Okay.
So in his Samhita, he has mentioned many surgeries like transplant. He used to transplant skin from one part of the body to the other part,
Okay.
which is called skin grafting today. And he used to reconstruct the nose, because in those days apparently loss of nose was pretty common.
Okay.
Yes, either in battle or because of punishment or because of leprosy. Leprosy, somehow the germs of leprosy, they tend to accumulate in areas at the peripheries, either in the fingers, the nose, the toes, and they eat through, and they used to lose their nose, so he used to reconstruct that.
Okay.
And he was also known for other operations like cesarean, delivery of baby from above, where it is not possible for delivery from below. So apparently 600 BC was a good time even in India for surgery.
It was back then 600 BC.
600 BC.
Okay.
So that is the recorded history as far as Indian history is concerned, Indian history of surgery.
Okay.
Then we come to further in the European history, around 500 years back, there was a person in Italy, Vesalius, who was the first person to record anatomy from cadavers with drawings and try to find out what are the organs, where they are, how are they related to each other. Because surgery is applied anatomy.
Okay.
So you need to know normal anatomy of the body to be a good surgeon. So his contribution was by way of that. The father of modern surgery is accorded to one person called John Hunter, which is in the mid 1740s, 1750s, who gave it a scientific basis.
Okay.
Right? And very interesting story is that in the UK, there was a hierarchy of doctors.
Okay.
You know, at the top were the physicians, below them were what is called as barber-surgeons. And below that,
Barber-surgeons.
yes, and below that were the others who used to practice traditional medicine, which included witchcraft and other things, bone setting, whatever
Okay.
it is.
Okay.
So this barber-surgeons, actually barbers are our predecessors. They are the first surgeons.
Okay, hold on. Barbers were the first surgeons.
Barbers were the first surgeons, yes. They were known as barber surgeons. So what used to happen is that the physician was supposed to know all the knowledge. He used to read the books and he used to treat all kinds of conditions. But when it came to surgery, now surgery is, the word surgery means working with your hands.
Okay.
So the physician felt that it is below his dignity to work with the hands. So he would sit on a chair and direct the barbers who were used to cutting hair and shaving. So they were used to using the blade and they were used to using the scissor to cut here and there and perform surgery on his instructions.
Oh.
So these barber surgeons over a period of time evolved into an association of barber surgeons.
Okay.
Yes. And you must have heard the UK Royal College of Surgeons, which gives the degree FRCS. So the Royal College of Surgeons earlier was called the Royal College of Surgeons and Barbers.
Okay, wow, that's interesting.
Yes. And basically after some time the surgeons who became very competent in surgery
Right.
decided that this was insulting and that they needed to, distance themselves from the barbers. So
Okay.
they had to fight a long legal battle.
Okay.
And finally sometime in the 1750s, UK Parliament passed the law that barbers are separate and surgeons are separate.
Well, that's a very interesting story, and it's it's pretty new. I mean, I have never personally heard
Yes.
about this.
But the most advancement which happened between the next decade or the next century, which is 1800 to 1900. Now there have been three basic or what you call milestones in surgery. You say the three A's. One is antisepsis,
Okay.
or the use of antiseptics. The second was anesthesia and the third was anastomosis. So somewhere in 1845 there was a person known as Joseph Lister. He advocated for the first time the use of carbolic acid and washing hands before surgery.
Okay.
You won't believe it, but before that, surgeons never wanted to wash their hands, and from one surgery to another, they would carry on with the same dirty hands and the same dirty clothes.
Okay.
So, what would happen was that it would lead to infection and death of the person, not because of the surgery, but because of the infection caused by the surgery. So, Joseph Lister, and there was another person from Vienna who was an assistant surgeon called Ivan, and he also did simultaneously the same kind of work in Vienna, and Joseph Lister did in England. But Joseph Lister did a proper scientific study and presented a paper. So he is accorded with the start of antisepsis.
Okay.
So after that, drastic fall in the number of deaths due to sepsis after surgery. So he advocated not only washing hands before surgery, in sterilizing instruments in carbolic acid, and treating wounds which are infected with dilute carbolic acid for treating infected wounds. So that was the first landmark which reduced the mortality of surgery.
Okay.
The second also came around 1845, 1860. In that period, Christopher Long, he was the first to use ether as anesthesia.
Ether is?
Ether is an anesthetic. It's an inhalational anesthetic.
Okay, okay.
You must have heard of chloroform.
Right.
So ether and chloroform came around the same time. Earlier to that period, because the patient was not anesthetized, it was necessary that you had to complete the surgery in a very short period. And it was not possible to do each and every kind of surgery in that short period of time. There is a good anecdote about this.
We would love to hear that.
Yeah, so we had an instrument which is called the Symes knife.
Symes.
Symes knife. Symes was a surgeon in the battlefield and he developed this knife. So during battlefield, the mines are there.
Right.
So what used to happen is they used to lose their forefoot, the front part of the foot when it used to come on a mine.
Okay.
And they would be brought back into the casualty on the battlefield itself.
The front foot, you mean the entire half section of the foot?
Yes, as they stepped onto mines.
Okay.
So it was necessary to stop the bleeding to do an amputation and remove the foot. So he developed a knife which went right across the foot and across the forefoot and separated the foot from the heel. And then you can rotate the heel and suture it to the bone and it became like a stump, so that the person could stand on that and take weight on that. Without artificial limb.
Okay.
Right? So this was known as Symes amputation. So the anecdote goes like this, that on the battlefield, the surgeon would take a bottle of whiskey, drink half of it, give half of it to the patient, and if that didn't knock him out, hit the bottle on his head and do the Symes amputation in 5 minutes. So all this circus was going on, but anesthesia per se allowed the surgeon more time to do a proper procedure. The other thing is that your normal abdomen has got muscles which are tense.
Right.
And it's necessary to relax that muscle so that after making the incision, you can actually go inside, spread the the muscles and tackle the problem. So muscle relaxants came in. That was a big evolution from ether, muscle relaxants to proper general and other types of anesthesia, which we will discuss in our episode on anesthesia.
Okay.
We're going to have a separate episode on anesthesia. So that was the second milestone. And the third milestone was, there was a surgeon known as Alex Carroll, who is supposed to be the father of transplant and vascular surgery. Now he learned joining two blood vessels, which are hollow structures, to each other by stitching them together.
Which century was that?
This is the same time in the 19th century, between 1845 1865. This was the time when these three milestones happened. So he learned this from a lady who was doing embroidery, and that lady is supposed to have done the embroidery for the French flag.
Okay, interesting.
Yes. So he learned the meticulous technique of joining two blood vessels. That also led to a lot of advancement, because you could now join intestine, you could join blood vessels, so you could stop bleeding, and you could do transplant surgery because you have to join the transplanted organ. So a lot of surgery advancement happened because of this technique. Alex Carroll was also given being the father of transplant surgery. But most of his transplants died because at that time they did not know about rejection of the organ.
Okay.
And transplants became successful much later, only when immunosuppressant drugs came in the market. And the first successful transplant was done in a pair of twins. Okay. So one twin had kidney failure, so the other twin donated his kidney, and they did that, and it was a successful. This was in 1954 in USA.
Okay.
Yeah. So we progressed very rapidly in the 20th century as far as surgical technique is concerned, because lots of new instruments came in. Then heart surgery developed, the other cancer surgeries developed, head, face, neck surgery developed, and lots of other procedures were done. Earlier it was restricted mainly, as I said, in the earlier time to abscesses, bleeding, amputation, and these sort of things. But all these modern surgeries, removal of the spleen, removal of the thyroid gland, removal of tumors in the head, removal of abdominal tumors, all this started in the 20th century.
That's pretty interesting.
Yes,
I mean, we never knew that it has started long back, in the prehistoric times, and throughout the time, we have seen so many evolution coming, and it's great to learn about.
And what is important is individual surgeons, because of their innovation and because of their thinking, developed lots of instruments. We have got what is called as the DeBakey vascular clamp, which is a clamp which is used so that it doesn't injure the blood vessel while it is sutured. Then there were so many surgeons who developed certain surgeries which have been named after them for various conditions as per their time. And these innovators, individual innovators, but by then what had happened was the surgery had become a known science, and there used to be gathering of surgeons where exchange of ideas and scientific papers were presented, that I did so many surgeries, this was the outcome, this was the complication, this is the way you can do it. Then somebody tried it, improved upon it, and that's how it made very rapid progress in the 20th century. And now, of course, the fourth milestone I would say is the keyhole surgery, which we already discussed in the last episode, where big incisions are not required anymore. A lot of surgery can be done through smaller holes. And add on to that is the robotic arm surgery, which makes it even better.
Okay, all right people, so this was pretty interesting video for us. A lot of new stuff to learn about how it all started and what all evolution has happened so far in the area of surgery. And would you like to tell us what we have in store for the next video?
Yes, we are going to discuss about investigations, because a lot of patients feel that doctors write a lot of investigations. So I'm going to bring to you why we need those investigations, what is the importance of most of the investigations, and also something about blood transfusion.
That's a very important thing to know further. Thank you so much, doctor.
Thank you.
So here we are, guys, at the end of this episode. Hope you like the content, and if you like the content, do press the bell icon for notification, hit that like button, share our video, and stay tuned. Thank you.